Australia's biggest city is starting to live with COVID. Asia will be watching that changed on Monday as Sydney, Australia's largest city and the capital of New South Wales, emerges from a strict lockdown imposed in June to contain a Delta outbreak. McTighe said she's excited to start her life again and see her loved ones, but she's worried about what having COVID-19 in the community might mean for the city of 5.3 million people. I think until everyone has a better understanding of this thing and how it keeps changing, we have to be concerned, she said. For more than 18 months, Australia has shut itself off from the world, closing borders and imposing strict lockdowns to stamp out COVID-19 outbreaks in an attempt to eliminate the virus. Now, Australia is emerging from its so-called cave and trying to live with it. Questions remain about how the hospital system will cope with any surge of new cases, the impact on vulnerable people, and how quickly Sydney can adapt to living with COVID. What happens next will be critical for both the city and Australia. But other zero-COVID countries in the Asia-Pacific region will also be watching closely to see if Sydney can succeed in keeping case numbers and deaths low enough to avoid overwhelming hospitals, while still allowing business to resume and people to get on with their lives.
The end of zero COVID. For the first year of the pandemic, Australia was one of the few major nations to successfully control COVID-19 through strict border restrictions, mandatory quarantine and temporary lockdowns. But in June, a Delta outbreak in Sydney quickly spread to the neighbouring state of Victoria and the Australian Capital Territory. I was always of the belief that we could have eliminated the non-Delta COVID, but I concede lockdowns with Delta are often going to be an unwinnable contest, said Mary-Louise McLaws, Professor of Infectious Disease Epidemiology at University of New South Wales. With early supply issues resolved, the vaccination program went into overdrive. Last week, NSW became the first state to reach the initial 70% double vaccination target. Other states are expected to reach that number in the coming weeks, and by the end of the year the entire country is expected to open up. Reopening Australia. Australia's reopening plan is built around total adult vaccination rates in each state, but inoculation statistics are not evenly spread. In some suburban areas of Sydney, full vaccination rates are as low as 30%, according to government figures. The state's Indigenous population is also trailing statewide numbers. For example, as of October 6, fewer than half of Indigenous people aged 15 or over on the NSW Central Coast had received both vaccine doses. That's a problem because Indigenous people generally suffer more chronic health issues than non-Indigenous people, putting them at greater risk of COVID complications. McLaws from UNSW said young people are likely to be among the first to take advantage of the freedoms afforded by reopening, so ensuring they are fully vaccinated is especially important. She compared it to patches of dry kindling which, if ignored, could eventually spark a bushfire. Young people, they start the fire, and then those groups that are at risk are the vulnerable and the Indigenous population and just generally regional areas outside the big cities, she said. Australia's strict border controls and quarantine measures allowed the country to avoid the chaos experienced in other countries in 2020, when COVID cases spilled over from hospitals into temporary medical units. However, despite 18 months of preparation, health groups have warned the NSW hospital system may not be able to cope with a surge of new infections. Last month, the NSW Nurses and Midwives Association urged the state government to boost staffing levels, citing research showing the system was under pressure even before the latest COVID outbreak. And on Thursday, after NSW's new premier announced a speedy reopening plan, Omar Khorshid, head of the Australian Medical Association, urged authorities not to be reckless. Sydney must take this opportunity to show the rest of the country how to live with COVID whilst protecting health and healthcare. He also urged Australians to play a role in taking pressure off the system. Where there's no cases, or whether there's 500 cases, or indeed 1,500 cases a day, the best thing you can do to support nurses and all those working in hospitals is to get vaccinated, he said. Setting a good example. But after it began to relax restrictions, Singapore saw COVID-19 cases soar to their highest numbers since the start of the pandemic. In early October, the country reimposed some restrictions to curb rising infections and take pressure off the health system. Last week, the number of people allowed to gather dropped from 5 to 2, work from home became the standard, and classes were suspended or moved online for students aged 12 and under. Ahead of the reopening, Australia's leaders have been careful to prepare their citizens for more deaths, casting it as the cost of getting back to normal life. But like Singapore, Australia has not ruled out reintroducing tighter restrictions if cases rise too quickly. Victoria, Australia's second largest state, will likely be the next to reopen later in October. Paul Griffin, Director of Infectious Diseases at Mater Health Services, said other governments would be particularly interested in how Sydney's health system holds up after reopening. "I don't think case numbers will be the key metric," he said. "I think it will be markers of significant disease, and intensive care admission and, of course, the death rate. If hospitals get overwhelmed by infections, and can't perform normal services safely, that would be a red flag," he said. But for now, she said she is very excited to live a normal life again. "You can see a bit of light at the end of the tunnel."
Thank you for watching. Please subscribe.